I'm Mohammad Maqsood. I'm orthopedic consultant at Lincoln County Hospital, and I work in the private hospital, Lincoln Private Hospital. I was born in Kashmir, and I have seen many medical problems where there was a minimal or equal to nothing facilities for the patient to be cared. I decided from that time when I grow up, I'm going to be a doctor. And since then, I worked hard to go to the medical school, and I graduated from Ayub Medical College, Ahmedabad, with the 5 gold medals, which I got because of high performance, and I was declared as the best graduate of the university. When I was trained as a medical graduate, and I did my internship, as I got a scholarship for higher surgical training, I moved to UK, and I moved to Edinburgh first, where I passed my FRCS exam. And at that time, the only ambition was to be a surgeon, but to choose a specialty is a very interesting incident. I met my supervisor who was supervising for my first year training, and he was orthopedic surgeon. So I attended a few sessions with him, and the way he was dealing with the patient and the rewarding outcome of the surgery, just like hip replacement or knee replacement, shoulder surgery, cruciate ligament reconstruction, they were amazing for me to see the patient who are unable to walk, who are suffering so much that they are telling the story that they can't sleep at night. They are getting up at night 3 times, 4 times. So I, at that time, decided that I'm going to choose this specialty as a trauma and orthopedic surgeon. So therefore, I started looking at a specialist training program, and I was very lucky to get a very high prestigious training program in Yorkshire, which is a well-known training program based at St James's University Hospital. And I completed my training in 1999. And then I was posted as a locum consultant at Lincoln, but then I went to Germany to do a trauma orthopedic surgery, and then I came back to take a full-fledged post in Lincoln. I'm orthopedic surgeon, and when I started as a consultant trauma orthopedic surgery in Lincoln, I took a few roles as a consultant orthopedic surgeon side by side. I was appointed as a clinical director for a few years. I developed the orthopedic surgery in such a way that not only doing surgery myself, but to train the other people. At the same time, I was very keen for the research to do in the trauma orthopedic surgery. I was conferred as a professor of trauma orthopedic surgery in Lincoln University. I did a lot of research, and I have published many papers on different subjects for the development, modification, innovation of different procedures in the trauma orthopedic surgery. I have seen throughout that not only doing surgery, but training the junior and training the other people to become surgeon. And I have maybe hundreds of surgeons who have gone through my training, and they have achieved and become a consultant orthopedic surgeon. As a consultant, I worked in Lincoln now 25 years, and I have I have a honor to say that in Lincolnshire, wherever I go, in a small town, in a hotel or restaurant, I will find 2, 3 people who will say, "Oh, you did my knee replacement, you did my ACL reconstruction, you did my cartilage repair, you did my shoulder." So this is something which is rewarding. I have been working as a consultant orthopedic surgeon and professor of trauma orthopedic surgery with Lincoln University. My special interest is lower limb orthoplasty. I specialize and trained in the hip replacement and problems around the hip joint, just like soft tissue problems, tendon problem, doing the total hip replacement, doing the hip resurfacing metal on metal, doing some surgery on the hip where you can regenerate the hip replacement to prevent or delayed total hip replacement. Similarly, I've got a special interest with the knee. I have been running a specialist clinic in the Lincolnshire for the last 25 years. I did some clinic at private hospital, in the Lincoln Private Hospital, and as well as in Lincoln County Hospital, where these specialist knee clinic, I was dealing with the complex problem like multiple ligament injuries, articular cartilage repair, meniscal repair, cruciate ligament repair, cruciate ligament reconstruction, and I have done so many revision surgery where the ligaments has been failed and the people has been referred from other places for me to review and redo the ACL reconstruction. Similarly, cartilage repair, I have a honor to say that I was the first one who started doing the cartilage repair in Lincolnshire, and I'm still doing cartilage repair, which is delaying the arthritis in the joints. And many of the patient I have done 15, 20 years before, they are coming back and say, you did the cartilage repair and we have prevented the or delayed the arthritis for the last 15, 20 years. This is quite rewarding, and I'm very pleased to see these people coming back and telling me their success story. Thank you.